Hey guys, it's Starla. I wanted to do a Q&A in different parts because I keep getting some questions from people and they are like the same questions over and over. So instead of repeating myself, I'm just going to do it all in one thing, in one video. But I'm going to break it down depending on the issue that I'm talking about. So hopefully this one will be better than the last one, and I won't stumble over my words and all that. So here we go. Part 1. What is Myelodysplastic Syndrome? It is also called MDS, and it's actually an umbrella term for blood conditions that can occur when the blood-forming cells in the bone marrow are damaged. This damage leads to low numbers of one or more types of blood cells. MDS is considered a type of cancer. In MDS, some of the cells in the bone marrow are damaged and have problems making new blood cells. Many of the blood cells formed by the damaged bone marrow cells are defective. Defective cells often die earlier than normal cells, and the body also destroys some abnormal body cells, leaving the patient with low blood counts because there aren't enough normal blood cells. Basically what that means is that my body, because I have MDS, my bone marrow produces immature cells that die off before they mature, and they also crowd the mature cells, also killing them off. So my blood levels plummet and I need like transfusions and growth factors and things like that. So in about 1/3 of patients, MDS can progress to a rapidly growing cancer of bone marrow cells called acute myeloid leukemia, or AML. Because most patients do not get leukemia, MDS was previously classified as a disease of low malignant potential. Now that doctors have learned more about MDS, it is considered to be a form of cancer. And unfortunately, I am within that 1/3. I am high risk of developing acute myeloid leukemia. In the past, MDS was referred to as pre-leukemia or smoldering leukemia. Since most MDS patients do not get leukemia, these terms are no longer accurate, and nor are they used. So this comes from cancer.org, and I will put a link in the description for you to read more if you feel like doing so. Okay, how did I get it? I got it from azathioprine, or Imuran. It is an immunosuppressant drug used for the autoimmune disorder that I have. It was so aggressive that it damaged my bone marrow. So it was the cause of my bone marrow becoming defective and producing defective cells and all of that stuff. So actually, MDS can be caused by other chemotherapies. It can be caused by other immunosuppressant drugs used to treat autoimmune disorders and cancers. Generally speaking, I don't think that it's genetic. It can be, but mostly it is medication that causes it, which is, in my case, that's what happened. I also provide a link to the NIH website for that. It says, let's see, when and how were you diagnosed? I was diagnosed on September 11th, 2016. I went in for surgery at Jefferson Medical Center in West Virginia, and it was a staph infection in my arm, and when they did blood tests, they saw that my blood levels were really low, and so they did all the titers and, all the blood tests, the diagnostic tests to see what it was. And before my bone marrow biopsy, they pretty much told me that I had leukemia, which obviously I don't, but that's what they said. And a word of advice as an off topic, and this is just my experience, but JMC is more of like a field office or something like that. I mean, they can do like small surgeries and injuries and all that stuff. But if you have something seriously wrong with you, like I did, my advice would be to drive the extra 15-20 minutes to Berkeley Medical Center, who are a lot more equipped to deal with things like this, because Jefferson just doesn't cut it. Anyway, so yeah, that's when it happened and where I was when it happened. I ended up getting a bone marrow biopsy shortly after being discharged from surgery, and the results were gotten at WVU, who told me it was Myelodysplastic Syndrome, and they at that time also called it pre-leukemia. They told me I was high risk, and because WVU is such a small transplant program, they denied me a transplant right out the gate, and basically told me that I would go home and die. I had 1 to 2 years to live, and that was it. So that was the devastating news that I got. But so far, so good. I'm actually beating their odds that they gave me. It says here, let's see, next question. What are your treatment options? Is there a cure, and what is your prognosis? This kind of goes back to the last question. Chemotherapy is a treatment. It pushes back the risks of developing AML or acute myeloid leukemia, but it is not a cure. A bone marrow transplant or stem cell transplant is the only cure, but it's very risky, and it has a 50% mortality rate, and that's in otherwise healthy individuals. It used to be like the last ditch resort, but now they're using it first because it has such a high success rate. But in those people who are successful, they can end up dying anyway from something that's called GVHD, which is graft versus host disease. And what happens is that the body just rejects the blood or the bone marrow altogether, and it kills them. It'll start attacking things like it'll give them like almost an autoimmune disorder. Like their bodies will start attacking their organs, like their heart, their lungs, their liver, their skin, their eyes, their mouth. It just depends. Wherever there's a weakness, that's what it attacks, and that's scary. So that could happen to anybody who has bone marrow or stem cell transplant. Supportive care, which is not considered treatment because it doesn't really do anything to help the condition. It just kind of helps the quality of life. It includes blood transfusions and growth factor. As an example, Neulasta or Neupogen. I'm sure you've seen the commercials for Neulasta. It increases the growth factor. Actually, increases the white blood cell count, and it increases the bone marrow's ability to produce mature cells. And it makes you feel like crap for a few days, but it actually does work. Prognosis without any treatment at all is 1 to 2 years. Prognosis with chemo alone is around 3 to 5 years, depending on whether or not it works for you. If it can push the leukemia back, or if it can increase your platelet levels and all that stuff, then it's about 3 to 5 years. Prognosis with a successful transplant is indefinite. Like you don't die. You never develop leukemia and you don't have MDS anymore. If the graft is successful, you're cured. If it's an unsuccessful transplant for whatever reason, you have to go back and start at the beginning and do all the transfusions and bone marrow biopsies and chemo and pre-transplant conditioning, and it's just a real pain in the butt. And if it's not successful the first time, there's no guarantee that it will be the second time either. I've known people who have had like 3 and 4 and 5 and they still died. So nothing is guaranteed with this thing. Let's see. Do you take chemotherapy? What kind and what are the side effects? I used to take Vidasa, which is considered benign in comparison with other chemotherapies that are more aggressive. I was on it from January 2017 to October 2017. Actually, I was supposed to be on it this week, but they told me that I didn't need it anymore and I shouldn't take it because my blood levels were stable. And with me moving to Pittsburgh, we should try to stay that way. So if I have chemotherapy, I may need a transfusion, and that would just complicate matters moving. So we're foregoing chemo until at least I get up there to my new hematologist and have him reassess the situation. The side effects of Vidasa, these are just things that I experienced, but there's a whole lot longer list of stuff. And yet you have to consider this is what they call benign as opposed to more aggressive chemotherapy. Bladder pain, cloudy urine, body aches or pain, burning or stinging of the skin, chest pain, chills, congestion, cough, difficulty breathing, dizziness, ear congestion, frequent urge to urinate, headache, itching or skin rash, hoarseness, loss of voice, lower back and side pain, muscle aches, nasal congestion, nausea, painful or difficult urination, pain, redness, swelling, tenderness, warmth on the skin, pale skin, runny nose, sore throat, stuffy nose, tender, swollen glands in the neck, tightness in the chest, trouble breathing with exertion, unusual bleeding and bruising, unusual tiredness or weakness, voice changes, vomiting, decreased urine, drowsiness, dry mouth, increased thirst, loss of appetite, mood changes, muscle pains or cramps, acid or sour stomach, appetite or decreased appetite, blurred vision, burning, crawling, itching, numbness, prickling pins and needles or tingling feelings, difficulty having a bowel movement, sorry, that's TMI, discouragement or depression, dizziness, faintness, or lightheadedness when getting up suddenly from a lying or sitting position, dry skin, fear or anxiety, feeling of discomfort or illness, feeling of sluggishness, feeling sad or empty or hopeless, feeling unusually cold, full or bloated feeling or pressure in the stomach, which sucks and makes you not want to eat at all. Heartburn, indigestion, joint pain, lack of appetite, large, flat, blue or purplish patches in the skin, loss of interest or pleasure, muscle stiffness, sexual dysfunction, nervousness, night sweats, postnasal drip, shivering, small clicking, bubbling or rattling sounds in the lungs, soreness or discomfort to touch or pressure on the skin, or stomach, stomach discomfort, upset or pain, swelling, swollen joints, trouble concentrating, trouble sleeping, unusual drowsiness, unusual warm skin, and weight loss. And I have included the link to the rest of that list, but that is what I experienced. And the worst of it was nausea, vomiting, and weight loss. I couldn't eat. I just couldn't. They had to prescribe me Marinol, which is synthetic THC, which THC is marijuana, the psychoactive ingredient in marijuana, just so that I had an appetite to eat, because it was just so bad that I didn't want to eat. So that concludes the part one. The part two will be about my autoimmune hepatitis and how I got there and what that means for the transplant and all that. So at 15 minutes, I think, or nearly 15 minutes, I think I will sign off. But I hope you guys have a really good day or night or whatever applies to you. Thanks for watching. Bye-bye.